Anti-inflammatory diet. How does it work? For those health-conscious, diet is key in managing weight and preventing certain diseases. One healthy example is called an anti-inflammatory diet, rich in compounds that fight inflammation. But how does it work? You've probably heard inflammation is linked to infection or other illnesses. That's right, but its purpose isn't exclusively bad. Our body needs inflammation to heal wounds and fight microbes. When cells detect an injury or infection, they release inflammatory chemicals. These chemicals then reach the immune system, which will send reinforcement. Inflammation allows white blood cells to easily cross between blood vessels to respond quickly to affected sites. While immune cells are busy fighting, other cells start the processes for tissue regeneration. The bad reputation of inflammation comes from abnormal persistence. This is problematic because there are no enemies to fight. Instead, the persistent event hurts healthy cells, increasing the risk of insulin resistance, heart disease, and even cancer. So managing chronic inflammation is a must to fight chronic illnesses. An anti-inflammatory diet includes, but is not limited to, herbs, spices, fruits, veggies, peas, beans, oily fish, and dairy. According to a study published in the Journal of Nutrition, several foods are associated with inflammation, such as red meat, refined carbs, sugars, salt, and saturated fats. Lower consumption of these will less likely trigger or exacerbate inflammation. If you have diabetes or arthritis, going for an anti-inflammatory diet may work. The replacements are designed to regulate inflammatory responses, just enough for what the body needs to fight infection or heal injury. For example, most fruits are rich in vitamin C, and this one helps in regulating inflammation. Another is dairy, specifically yogurt, to make the gut healthier. Immune cells like macrophages and dendritic cells are found in the gut, and eating foods rich in prebiotics and probiotics may optimize their performance. Despite the upsides, some studies have identified drawbacks. One study published in Contemporary Clinical Trials Communication suggested that not all fruits regulate inflammation. That study suggested avoiding tomatoes and replacing them with others like pumpkin. But a different study published in the journal Atherosclerosis suggested otherwise, wherein tomatoes could help fight inflammation. So, where should tomatoes be? Probably best to consume in moderation. Tomatoes have two chemicals that started the argument. It has solanine, a toxin believed to spike inflammation, swelling, and joint pain. It also has lycopene that does the opposite, control inflammation. Whatever healthy diet you choose, nothing exists to cure diseases. Diets cannot replace treatments and vaccines. It is one thing to help prevent, and it's another to actually prevent or treat an illness. What diets have you tried so far? Have you tried the anti-inflammatory diet? Share your thoughts in the comment section. Till our next video, thanks for watching.